Hello, my name is Sandy Earl, and I am one of your professors here, and I am also the Associate Dean for both assessment and student success. So I'm going to tell you today about how we do our student self-assessments, which we do every semester here. So I want to make sure you understand the process, and we've made some changes this year. So I just want to make sure that you review this and know what to expect uh, for each semester. Okay. So first, what the heck is it? Well, you're going to get a link to a Google form where you will be asked to assess yourself on each of the educational outcomes that we have for our program. These educational outcomes are broken into three areas, which is knowledge, skills, and attitudes. And these are the knowledge, skills, and attitudes that we expect you to develop here as a pharmacy student that you'll need to be a great pharmacist. So we have you assess yourself at least once a year on each of these now 12 areas. So you will be asked half of them in the fall and half of them in the spring. And you'll go through and it's your own self-assessment. Where do you think you are? And these are the same attributes that the American Association of Colleges of Pharmacy and our accrediting body have chosen for what pharmacists need to have. So you can see, you can go to this link here. If you click on this link at here, it will take you to an article which outlines these curricular outcomes and entrustable professional activities, which are called COPA, C-O-E-P-A. We love all these acronyms in pharmacy. So it used to be called the CAPE Standards. It's now called the COPA. And they have basically put these educational outcomes, which is synonymous in this case with curricular outcomes, with some entrustable professional activities, which we're going to talk about next. You're going to also be asked to evaluate your progress on the entrustable professional activities of a pharmacist, or the EPAs. In this case, it has nothing to do with the Environmental Protection Agency, but the entrustable professional activities of a pharmacist, which are also described in the COPA article up here. So entrustable professional activities of a pharmacist are just what they sound like. They are the things that we as the public would expect and trust our pharmacists to be able to do and do it safely and well. You'll also be asked about your progress on long-term assignments and optional questions. You don't have to answer them, but we'd like to check in on your mental health. There's a mental health crisis, you know, especially in students of your age. So we like to check in with you. You don't have to share this with us, but we like to be sure that we are asking about this as often as we can. So that's why we have those. There's only 3 questions, and they were provided to us by our counseling center. We might ask you about a new policy that we've implemented to make sure you understand it and to bring attention to it. We also, at the end, we'd like you to take all this information and reflect on it and think about what you're going to do to have the best career as a pharmacist as you can have, and make sure that you're going to stand out from the crowd. So what are you going to do that's different than other people? How are you going to use your IPPE time? How are you going to use your elective time? Other things that you have that you can be different than other people that will be in the job market just the same as you with your pharmacist license. We have a pretty strict curriculum, so you have to think proactively about how you're going to stick out. So what's the COPA? I like to call it the Copacabana, but only people my age know what that is. It was a Barry Manilow song. You can listen to it if you want. Anyway, the COPA, which stands for Curricular Outcomes and Entrustable Professional Activities, combine the former CAPE standards, which are now called Educational or Curricular Outcomes, and the EPAs. So it just puts them all together under one tent. And they put together by the American Association of Colleges of Pharmacy and the Accreditation Council for Pharmacy Education, which is the body that actually accredits our program. These are our graduation standards. These curricular outcomes or educational outcomes are our graduation standards. And we must show that each student is developing in all the areas. So the way we show that is by having you do your self-evaluation and talking it through with your advisor. So first, educational outcomes are curricular outcomes. How will you self-assess on your educational outcomes? Well, as I said, there are graduation standards, and they describe the knowledge, skills, and attitudes that all pharmacists need to demonstrate upon graduation. They were known as the CAPE standards. So in the fall, you're going to rank yourself on learner, which is a knowledge assessment. And then all these in red are skills. So each semester, you're going to assess yourself as a learner, because that's really the biggest thing that you're doing here. But you're also going to be evaluating yourself in the fall on your ability to problem solve, communicate, your ally as being an advocate for your patient, a provider, and actually advocate and ally, they're different, right? They switch this around. I got to double check that. They switch this around. And there are definitions for all of these for you. Spring semester, you are going to, again, evaluate yourself as a learner. And these skills of steward, collaborator, promoter, and leader, as well as the attitudes of being self-aware and professional. So you have a little more work to do in the spring than in the fall. But in all, now I have to just check that quick. And they're different. Okay. Sorry, ally is cultural and structural humility. So ally is about being culturally appropriate. Advocate is advocating for your patient and for the profession. Okay. So any question, you're going to be tested at using the software of ExamSoft. Each question that we write is tagged to who wrote the question, what's the Bloom's level, is it a recall question, or do you have to actually analyze, or is it brand new creation? So it's different levels of sophistication and being able to answer a question. So it's going to be your author, your Bloom's level, the subject area, any educational outcomes, and then your board exam domains as well. The elements of any OSCE or other rubrics will also be tagged with these educational outcomes. So the evidence for each ranking for the educational outcomes, of course, is your ExamSoft categories, your GPA, any co-curriculars, extracurriculars, organizations, interests, volunteered and paid work, any electives you have taken. So in other words, we're going to ask you, what's your ExamSoft rating? And then for other evidence. So that's up to you. Remember, it's your own self-evaluation. So when you were thinking about how good am I at this, think about what are you doing that would either say I'm not really that good at it, or I'm great at this, or I'm doing fine. So what evidence do you have? So make sure you share all the stuff you're doing with yourself and go over that with your advisor. And a lot of times ExamSoft categories are not going to be very useful because, how well does a multiple choice question answer whether or not you're a good leader, right? So the ExamSoft category data may or may not be very helpful. But here is how you will get your ExamSoft data. First, I'm going to send you your cohorts average. So the average scores of your whole cohort, your class. So this is going to be the group average. And so for anything that was tagged with learner of pharmaceutical science, whoopsie, of all the questions, your whole class on average got 87.45% of those correct. So if you're above that, you could say that you're strong in this area. If you're below that, maybe you're not so strong. Maybe this is something that needs work. So you can compare yourself to the averages. So pharmaceutical sciences, clinical sciences, caregiver used to be a category. It isn't anymore. But here's how your class did in that area. You get the idea. These are going to change because I have to update since this is a brand new. These were the old CAPE standards. You will also get your cohort's number of items. So this tells you how many questions were asked in each of these areas. If there's only one, you can't put much credence in what data you got from it. If you've got 82, well, yeah, then maybe you can. So you can say it's a pretty good measure. Here's what your individual data might look like. So you will be asked to put this data into the form. So when you're asked about your learner farm SCI points, go ahead and put in 0.81. Okay. And then here's how you will rank yourself. So please rate yourself on being a learner. And then I will put the definition of learner here. Are you an exceptional learner? This is a strength. I'm a good learner. I'm at or above average. At times I struggle being a good learner. I need to improve in this area, or being a good learner is a weakness of mine. I need help to improve. So it's basically a Likert scale of how you are doing in that area. And then after that, you'll be asked for why you rated yourself that way. So here's another example. Here's advocate. So here's what your answer was. And what's your other evidence? So maybe you, as an advocate, maybe you are the one that has put together a letter writing campaign about patient advocacy for your state senator, or to support the profession of pharmacy in some way. So you participated in that. That would be evidence of your self-assessment as an advocate. So hints: utilize ExamSoft data. Know that you may or may not have sufficient data in each area. You compare this average data to compare your data to your cohort. It may help you to rate yourself. Again, this data may not be helpful for some of the educational outcomes. If you have very few questions in category, your rating may be falsely high or low due to small sample size. Include other evidence like work, clubs, co-curricular, extracurricular, and electives in your additional proof, or additional information on why you rated yourself this way. Maybe you should start thinking about, maybe you would benefit from a class outside of pharmacy. So self-assessments of EPAs. EPAs stand for Entrustable Professional Activities. There are 13 of these. 10 of them are aligned with our pharmacist patient care process. These are another acronym that you're going to hear, PPCP, which is just basically how we organize, how we think about taking care of a patient. You can look at that here if you click on this link. These are activities, not skills, or well, they are kind of skills, but they're not the same as the educational outcomes. These are actually activities that you're doing in a pharmacy. So all students are entrusted to do this in an experiential setting with differing levels of supervision, using an entrustment decision scale that's found here. So basically, you should be evolving from observation only to direct supervision. So observation only is where you're just watching. You're standing and watching a pharmacist or a pharmacy tech do something. This is appropriate for IPPEs and maybe P1 skills lab. And sometimes maybe you're at the next level where the pharmacist could directly supervise you doing something, or your teacher could directly supervise you doing something. This again is appropriate for IPPEs, your P1 and P2 skills labs. Reactive supervision is where you have, where you actually do the work as a student, and then a supervisor looks at it almost immediately and gives you feedback, but you're not necessarily being directly supervised, but supervised just after it occurred. This is appropriate for IPPEs, APPEs, and P1 through P3 skills labs. So at graduation, at a minimum, we expect you to have all your EPAs at reactive supervision level or higher. So that's the goal, is you must have all your EPAs at the reactive supervision level or higher. Of course, we'd like them to be higher, but that's at a minimum. So you'll be asked to rate yourself every semester on EPAs. What's your role? Gather supportive evidence for each of these EPAs and educational outcomes, know your GPA, get your ExamSoft data, list other things that you have done, think about the other things you've done, make sure you have your IPE evaluations and your lab OSCEs for your EPAs. So for your first semester, you're not going to have your IPE evaluations, and you may not have any lab data for your EPAs. You just might not have any data. On each of these questions, you need to list your evidence and rank yourself, based upon the data, identify strengths and weaknesses, and then use the information to formulate a plan on how to utilize your strengths and shore up your weaknesses. Plan how or if this will affect which courses you might want to take or how you will use summers. And then you must submit this before you schedule and talk, then make an appointment with your advisor to go through your self-evaluation and review this information with your advisor and make a plan to go forward. Mental health questions. These are 3 questions that were given to us by our counseling center. So you rate how overwhelmed you feel. Do you feel like you worry more than others, or is it hard for you to feel joy? And we'll talk that through with you also. So here's some mental health resources for you. And so now what? You're asked to rate yourself on each of the educational outcomes for that semester. You're asked to rate yourself on each of the EPAs for that semester. You will be asked additional questions. The last portion, and probably the most important, is for you to reflect on all this and make a plan for going forward. You can do this with the help of your advisor and submit and talk through this with you before you register for the following. That's it. Thank you.